What food sensitivities trigger GERD in infants and children? Imagine your little one fussing after eating, or maybe they're vomiting more than usual. Sometimes, certain foods can be the hidden cause behind these discomforts. Today, we're exploring what food sensitivities can make gastroesophageal reflux disease, or GERD, worse in infants and children. In many young kids, the main food culprit is cow's milk protein. This is because some children are allergic or intolerant to the proteins in cow's milk, which can cause inflammation in the digestive tract. When this happens, it can lead to increased reflux symptoms like vomiting, irritability, or feeding problems. Soy is another common trigger, especially in babies who are sensitive to it. Soy-based formulas are often used as alternatives, but if a child is sensitive, symptoms may persist or worsen. Other foods like rice, oats, barley, and certain meats or vegetables can also cause reactions, but less frequently. These sensitivities cause irritation or inflammation that makes acid reflux more uncomfortable or severe. There's a condition called food protein-induced enterocolitis syndrome, or FPIES, which can mimic or worsen GERD. It usually shows up in the first 6 months of life and is often triggered by cow's milk or soy. Babies with FPIES might have severe vomiting and diarrhea after eating the trigger food. Avoiding these foods strictly is necessary to prevent symptoms. It's important to tell the difference between GERD caused by food sensitivities and GERD that isn't related to allergies. If a food allergy is involved, removing the trigger food or switching to hypoallergenic formulas can help. But if GERD isn't linked to allergies, other treatments like feeding changes or medications might be needed. Doctors sometimes recommend allergy testing to identify sensitivities. Managing GERD with food sensitivities involves eliminating suspected foods carefully under medical supervision. Using hypoallergenic formulas can support proper growth and nutrition during this process. It's also worth noting that long-term use of acid-suppressing medicines might increase the risk of developing food allergies. So, these medications should only be used when clearly needed. In summary, cow's milk protein is the most common food sensitivity that worsens GERD in infants and children. Identifying and removing these foods can help reduce symptoms. But it's essential to work closely with a healthcare provider to ensure your child stays healthy and well-nourished while managing these sensitivities.